Hello and namaste. Welcome to the COVID Care series presented by Apollo Hospitals. This is Dr. Srinidhi Chidambaram, and I really hope that you've been staying safe, well, and calm over the weekend. The COVID Care series, as you know by now, aims to address the most crucial and critical aspects of COVID-19 information so that you can get the most factual and authentic information so that you don't have to really get confused about all the myths and misconceptions that float around about the COVID-19 pandemic. In a way, this will also help to reduce your stress and anxiety, which could contribute to your mental health. Mental health during COVID 19 is a very important area that needs to be understood, and we need to be aware of it. It's often overlooked. On the one hand, there are COVID 19 patients who go through a lot of emotions while they are ill, like they might be having fear, anger, or anxiety, or irritability. And this can even take the form of post traumatic stress disorders, anxiety, and depression. The families of such patients are also affected with stress, and some unfortunately have to cope with grief and loss as well. The elderly and the vulnerable feel even more so during this time. Homemakers worry about running a home, employees worry about salary cuts and job losses, students worry about careers and exams, children feel lonely and isolated, travelers may be stuck in faraway lands. Even in those who haven't been directly affected by COVID, a feeling of doom and gloom always persists these days. We obsessively watch news channels, and constantly we are thinking about COVID 19, and that takes its own toll. As for people with psychological and psychiatric disorders, managing these diseases during the pandemic time and during lockdowns is also very challenging. Such a complex web of emotions and psychological factors need to be addressed. And so I'm very happy to welcome Dr. Namita Singh to talk about fighting the COVID 19 pandemic with mental strength. Dr. Namita Singh holds a PhD with specialization in neuropsychology. She has worked in a military hospital, in a premium lab of DRDO, Government Medical College, and faculty member of premier universities in India and South Africa. At present, she is a consultant psychologist at Apollo Health City, Hyderabad. Her areas of interest are many and include neuropsychological assessment, rehabilitation, movement disorders, behavioral cognitive assessment and management of children with intellectual disabilities, counseling for substance addiction, post-traumatic stress disorder, and many others, including suicide prevention. Hello, Dr. Singh. Namaste and welcome to the COVID Care series of Apollo Hospitals. And we are eagerly looking forward to your insights on how we can all fight COVID 19 and cope with it using our mental strength. Over to you.
Hello, namaste. It's an honor and privilege to be here talking to all the people across the globe in a true sense, trying to support and help people as an outreach program to help them cope up with the challenging times. As all of us have been mostly seeing the ups and downs of the COVID scenario in terms of infection, physical health issues, economical disruptions, daily life routine disruptions, many of us have been overwhelmed, if not exactly challenged. I will reiterate that yes, COVID 19 infection as a pandemic has affected mental health of individuals from pediatric, that is small kids, to geriatric, that the elderly people across the globe. It has dramatically altered social and working environments in several ways. Social distancing policies, mandatory lockdowns, isolation periods, and anxiety of getting sick, along with the suspension of productive activity, loss of income, fear of the future, fear of getting the infection, jointly influence the mental health of citizens and workers in all spectrum of workforce. This mental stress concerns also relate to a high rise in different kind of violence, which has been part of our society otherwise, but pandemic has led to a very big increase of domestic violence, violence against women in regular households. Older elders, adults have experienced disproportionately greater adverse effects from the pandemic, including higher mortality due to the age factor, concerns about disruption of their daily routine. Many healthy elderly people like to go for a walk, and it's a part of their daily routine to meet up with friends in parks or common areas of apartment. But now they can't do because there's a fear and there's a high risk also, which causes a major disruption in their daily routine. Access to medical care, access to general social events around in families and social circle, difficulty in adapting to technologies. Many of the elderly are not really technologically computer savvy. So sometimes for them to have a good connected Zoom call with a distant relative or family is a big stressor. Isolation, for them, it is an exacerbated cause for mental health conditions. So in that sense, COVID-19 as a pandemic has just not caused clinical scenarios. It has brought about a major change in the way we lived. Many of us still think of going back to the old life, the life in December 2019 or henceforth before. But to be true, many of us have to accept that that is only a part of our memory. That normalcy, what we thought would not be the same ever again in the given human near future. The way we deal, the way we work, the way the education system is going to be has changed drastically. When I talk about education, children, teens, older students, university students, all have been severely impacted due to change of mode of education, lack of real-time interpersonal interaction with friends and peers. They're learning from their teachers in person, learning social cues of behavior. As we all have seen in our families, in our social circle, small kids, they learn a lot of social mannerism, good or bad, while playing with their friends. But now that personal interaction has been taken away, which makes them lead a kind of a very individualistic life, which is obviously in the long run going to impact their way personal interaction and personality shapes up. Of course, because of the excessive access to the virtual world, thanks to the Zoom online classes, many of them have become addicted excessively to gaming and content viewing. We get a lot of parents complaining, ma'am, the kid is always on the phone or on the system. And we can't make out, are they studying really or are they doing some games and on the social media? So these kind of boundaries are very blurred. And because the scenario is very volatile, there cannot be extremes of imposition of anything on anybody. I would like to say and mention quote rather Viktor Frankl. He's the propagator of logotherapy, a Holocaust survivor, and also a very well-known psychiatrist of his time. He said, when we are no longer able to change a situation, we are challenged to change ourselves. And again, I'm reiterating that it is very important for us to now follow the 3 ACEs, which I promote very strongly in the times of COVID-19. Acceptance, attitude, and adaptation. These 3 A's are very important for our survival today, tomorrow, and in the long term of our recovery process. I have also come across a lot of people feeling extreme anxiety scenarios related to the physical symptoms of not the COVID infection, but related common illnesses. It can be a very common flu or a cold infection. But now people equate it to being infected, and they go on a frenzy mode to really get medication, seek consultation. I'm not against that. They should not verify or consult a qualified medical professional, but changing doctors over a week of 2 weeks, seeing 3 doctors to reaffirm their symptoms or medication is putting excessive stress on the brain. Sometimes we also need to be mindful that any overdoing, whether it's a physical exercise, whether it is excessive nutrition input even to the body, is unhealthy. So there, I want to again emphasize that moderation. By doing excessive steam inhalation, it is harmful. By eating too much of ginger, garlic, or any decoction, it is a harmful system input to your digestive system. So it may be not the fear of the COVID, but the extra load on the system which is going to make you sick. And here I would lastly like to very strongly emphasize, please do not believe on the windmill information. Yes, Indians are getting more better of education accessibility, but there has to be a mindfulness emphasis on being educated and literate. There's a difference there. I can be nicely read with books and information from different web resources, but I have to be mindful that what I am reading and where it is coming from. Everything we read on social media does not 100% apply. So many times people are promoting negative behaviors by overloading their brain, which results obviously into more stress, more derailed sleep pattern, and unhealthy choices. In the end of this scenario, I would also like to reiterate that human beings are creatures of habit. So we want to be having a pattern to our daily routine. We want to be more accomplished in our small chores around the daily routine. By being anxious, by being over concerned, by being over worried, we lose the track of those small doings, which makes us obviously ineffective in our daily routine management, whether it's work-wise or whether it is daily chores of the house. As I said, human beings are creatures of habit. It is very important to have a small day-to-day routine. Start each day with a task completed. It can be a small task of cleaning your work table. It can be a small task of making your bed. But these small accomplishments make the brain feel a sense of achievement. A task completed is a sense of doing. Another important thing, because we have been in lockdown or restricted movements, many of us follow the social media or OTT content sitting on the couches or our beds comfortably. A strong statement, but sitting is the new smoking. It kills us equally as smoking. So even if your lockdown period is on, if your quarantine period is on, if you're generally healthy and just having a mild infection, or even if you're not infected, move around the house. Do mundane things. It can be a small cleanup. It can be a small activity of rearranging things. But be active. Don't be sedentary. Respect everyone. When we are vulnerable, when we are anxious, we start to becoming irritable and upset and angry on everybody and anybody. That makes us, our brain go into a defensive mode, which makes us get more stress hormones secreted in our body, which is obviously not healthy. We have to accept life is not always fair, and all of us will fail one or the other time. But human race has come out of these lakhs and millions years of evolution in a format of trying and failing and retrying. Our genes, our brain are designed to overcome odds. So keep that faith. One important catch for current scenario is do not over plan. Do not plan too many things for the next few months, or I would strongly say even a 1 year or say. Right now, because the environmental situation, social scenario, economic situations are very fluid. Things are changing too fast. And as I said, because we like to plan and accomplish, if some of those plans do not meet us or we are not able to achieve, we feel failed. But having small day-to-day routine plans or small weekly plans is always welcome. It helps the brain to relax and it helps us to be accomplishing things in a go.
Sure, doctor. Thank you. So I just wanted to ask you, do people who have COVID-19, especially those who are isolated and hospitalized, or even those who are isolated at home, now, do they have, are they prone to develop some mental conditions either because of their isolation or due to fear, or does the disease itself cause some psychological issues?
Yeah, it's a very important question. Thank you. Uh, I'll take it in two parts in terms of people who are individuals who are hospitalized. So, yes, people who are very sick, very ill, hospitalized with COVID-19 are at high risk of developing delirium. Delirium is a disorder characterized by fluctuating attention and disorientation. It can have emotional extremes, agitation, paranoia, that is feeling fearful, or sometimes the opposite. It can be a very flat emotional expression. Some people do develop hallucinations. The sleep wake cycle is usually disrupted, and the delirium usually increases as the day progresses. Now, delirium otherwise in hospital is a common occurrence, affecting 15 to 10% hospitalized in general medical conditions also. And it goes, that percentage goes to 50 to 70% in ICUs. Delirium can be caused due to very many reasons: infection, medication, withdrawal, surgery, and it seems to be a common brain reaction to serious illnesses or consciousness altering medications. Treating delirium is not a major problem. It can be just done through careful monitoring of medication and the withdrawal, treating underlying infections and making sure there are plenty of cues in the hospital room at about time, date, familiar items for the patient, such as a photograph of a family at the bedside. Because see, now in extreme, moderate or severe level of COVID infection, usually the nursing staff or doctors are clad in PPE with face mask, and their faces and expressions are very restricted due to the gear which they are wearing. So the patient who is already weak and fragile gets more worried, and the brain can't find any visual or memory cue to identify that person. So delirium becomes a major issue. But reassuring, I even say to some family members, if that your family member is hospitalized, send audio clips, let them hear the voice, which will help because the voice is embedded in the memory system. That itself will soothe. Give them a chance to hear some popular music which they are accustomed to. It will help the memory recall and get them oriented. Another things which happens, uh, quite commonly, which have been identified through the study over this 1.5 year kind of time, is that beside deliriums, the SARS-CoV-2 has direct effect on the brain and the nervous system. There have been documented cases of encephalitis, which is a brain infection, spinal cord infection, seizures, nerve damage, neurodegeneration, and neuroinflammation. In some of the studies, some of the scientists have found the virus particles in brain. High levels of brain inflammation can also lead to memory loss, cognitive fog. Many patients do feel that they have kind of a foggy feeling. They can't have an instant memory recall, or they take delayed reaction time to answers, or word finding difficulty during normal speech presentation. Some of them do develop depression, which can sometimes last for significant periods after the acute infection with the virus is over. Up to 45% of patients in the hospital do experience some sort of neurological symptom. So it's not just a respiratory illness, it can have profound effects on the brain also.
Thank you, Doctor. Another question is, are those people who already have mental health issues, are they vulnerable to COVID infection, maybe in the context of dementias and such things? Like, will they be able to take precautions?
Yeah, see, when we, whether it's a mental health or a physical health system, if it is already compromised, the vulnerability is directly increased. So here I'll just give you an example that this pandemic's uncertainty and stress combined with disrupted routines is very much increasing some people who are into alcohol or drug abuse to take it as a norm to drink to get away with the stress. They undercut efforts to remain sober. Again, many stressor can cause an increase of reliance on alcohol, nicotine, or other substances. Now, these kind of behaviors, they boost chances of contracting the virus faster and with more severity, because under the influence of the substance, people lose inhibitions. The basic analytical process of the brain is shut down. They lower their guard, and they may be very casual about distancing, hand washing, or COVID appropriate behaviors. Because of lockdowns, isolation, limited or no access to adequate medical care, restricted hospital visits due to fear, or no follow-up or refills of medication available, people who already have pre-existing mental health issues, they can be increased quite a lot. They can be exacerbated. As about dementia or other neurological or mental health issues, sometimes the diagnosis can be delayed, because again, people are not having access to normal social behavior of interaction, mixing up, trying to cope up or express to any near dear about the problem. So that way, these scenarios do exacerbate the existing mental health issues.
What are the steps to deal with isolation, loneliness, and quarantine when somebody is exposed to COVID-19?
Okay.
Sometimes even when they travel also to other countries, it's even more isolating when they have to
Yes.
isolate all hotel room.
Yeah, it's very important thing that many of the individuals are going through this scenario. Now, again, if I have to put it into a couple of important aspects, it is like some people are already in long time lockdown. Even for as simple as working from home, For some people, it is quite strenuous because their colleagues, their personal interactions have been impaired. Some people have been quarantined, or as you said, traveling from overseas, so forced quarantine of 14 days or whatever uh, the regulations of the particular country says. It is important to stay socially close even when maintaining physical distance. Stay digitally connected by keeping in touch with friends, colleagues, and family using email, apps, or social media. As simple as in your free time, watching same movies, reading the same book, and then discussing it in virtual meetings. Having a virtual chat while drinking coffee or a cup of tea or a milkshake together. Daily routine, as I said earlier, also, first of all, plan and uphold a daily routine and also create a well-being plan for the day and weeks. If somebody is just in a quarantine situation, if they don't have a routine, they will feel more overwhelmed and they will feel more lonely. But if a routine is set, it helps to accomplish. It can be that, okay, 10 o'clock, uh, one chat, 15 minutes quick chat with the old classmate. Post lunch, one game of a chess round or a video karaoke song session with some group of people, using activities which require some skills but are not externally motivated. As simple as going to the window and looking around, getting some fresh in the morning and evening. Make it a part of the routine. You can't step out of the house or the facility, but you can surely enjoy the scenes around, whatever limited, and it will give your brain some other meat to think about. You will not feel lonely. If you are in a home facility, having a list of things that you would have wanted to do sometime in life but have not been able to, there's not a single human being who will not have a list of to-dos that I wanted to do in my teens, but I didn't have time because I was preparing for my exams. Now I'm an adult. Now I have a job or family, so I can't do it. Use these times to go through those activities. Listening to some healthy podcast, cleaning the house. If you have a balcony or garden, that's one of your biggest saviors. Plants really pep up our mood. Playing board games, if you're not highly infectious state, listening and discussing some radio, TV shows which take a good time of our daily routine. Otherwise, again, if the health condition is okay, taking turns of caring for children. Nowadays, there are very many online resources for activities or to do at home with children, adults. There are self-help groups. Even if you don't have a self-help group, and you have access to internet, you can easily find one. Maintain hope, believe in something meaningful, whether family, faith, country, or value system, because our motivation is derived out of these. Use stress management techniques. Physical relaxation techniques can reduce stress levels very drastically. They are useful methods to manage pain and emotional turmoil also. Most people are familiar in today's time with stretch management technique, but the sad part is we don't practice it, we don't apply it, we think it is for somebody else. So these important things help us to sustain through that loneliness or quarantine period. One important thing is accept your feelings. It can cause a lot of emotional reaction, anger, frustration, anxiety, regret, second guessing yourself, self blame. These days I'm seeing a lot of self blame. If I could have not done that, that would have not happened. But see, that if and this that is not in your control in today's context. What matters is here and now. And if we make here and now more meaningful, obviously, most likely tomorrow will be a bit better. These are not the normal circumstances, but we have to accept them that this will also change eventually.
Doctor, we now have a couple of questions from our live viewers. So there are almost 7 questions. So we need to, we have another 5 to 10 minutes. So
Sure.
I'll just read them out.
Sure.
How can we deal with biological anxiety?
Okay, that's an important question again. I would like to emphasize biological anxiety may be pre-existing much before the COVID pandemic. And if a person is really not able to face or deal with it, the first line of intervention be that see online, obviously, or in person, depending on the environment you are, a psychiatrist. It is okay to get some medication and start with it. And then along with that, find a good qualified psychologist, because anxiety, whether biological or circumstantial, has very many components, as all disease and disorders. So with medication and with psychotherapy, it is easily manageable, and it is can be controlled effectively.
How can I monitor my mental health in this situation? What is a sign of concern? Like what is normal and what is something that should trigger an alarm?
So again, there's a very fine line, but very basics. If the sleep cycle is very drastically altered, if an individual is not able to sleep for 3 4 nights consecutively, over worrying, change in mood, very flat effect, or highly irritable, crying on or being upset, angry on small mundane things, wants to be alone all the time, no particular routine of eating or taking personal care. These are alarm signs. Another big alarm sign is feeling suicidal or having continuous thoughts of suicide or self harm. These are signs which one needs to be very well aware of. And if these kind of feelings or emotions are boiling too much in an individual, it is important that they seek support, make a conscious effort to reach some professional.
I feel anxious about catching the COVID virus or transmitting it to a loved one. What can I do?
So basics which we have been told from the start of the pandemic scenario: social distancing, masking, and frequent hand wash. These are the physical components which we can easily control. We cannot control the environment outside. But more than this pandemic is giving us a stepping board to really change and overhaul our lifestyle. We have to accept that we were taking too many things for granted. How many of us are actively engaged in physical health care? You have to ask these questions yourself. This is the time to revamp your own version for a better you. So instead of worrying ki I will get the infection, we make a point that we eat healthy, we make a point that we exercise daily. I'm not saying extremes, start somewhere. I would use the story which all of us have heard in our childhood about the rabbit and the tortoise. The tortoise could win the race because it kept on going. So as I said in the beginning, human race is not so weak that we will just bow down and go away in oblivious darkness. We will overcome it, but create environment which gives you positive energy rather than worry. Do not over engage on news items. I'm saddened to say the kind of news we are getting will make any of the strongest mental person also become a mentally ill patient to severe illness. I'm saddened by the impact that our media is not being wise enough or being judicious enough to show content which is not appropriate for the masses. So avoid that. If you are going to overload your brain into getting all those kind of news, then obviously the fear will become more and more. You have to remember stress is inversely proportional to immunity. So keep your environment healthy and emotionally stable, and everything is going to be okay.
Um, how do I balance washing my hands enough and not becoming obsessive about it?
If you're in the home environment and generally everybody is healthy and uh, practices good hygiene, you just wash your hands when you're about to eat, if you have used a washroom, or if you are doing dishes, the normal routine. Yes, if we are outside, out and about in public arenas where we are in contact of touching lift buttons or accessing public doors, gateways, then keep a hand sanitizer with you. And it is okay to clean your hands if you are into that environment 2 times, 3 times. Some people are washing hands in home environment even after touching a chair. That is obsessive behavior.
How can I talk to my children about the COVID infection without making them anxious?
That's a very relevant and a very important question. So kids do not need to be explained in detail about A to Z of COVID. I will say age appropriate information that yes, it's a small bug which can cause our tummy fever to come and make us feel painful or discomfort. But if we become more healthy by doing deep breathing exercises, by eating the fruits which you don't like, or by eating the veggies which you don't like, you're not going to get it. Make it light for them. And obviously, even if you do not make it very obvious, but your persona is giving the anxiety, the kids are going to pick it up anyway. So that's why I'm reiterating the information that practice self-compassion, create a gratitude journal. We have to learn to be thankful that yes, we have a home to live, we all are with each other. Don't be angry and annoyed at the system. You may be just sitting with your kid watching some news or reading newspaper and cursing the government. The kid is going to pick up the anxiety that mom, dad, or the adult is unhappy. They may not verbalize it because their comprehension levels are low, but it will be passing on to them. So age appropriate simple words, not details. Some family member may be hospitalized due to severe illness, and then also we need to re-emphasize that doctor is taking care, most likely things are going to be okay. We need to take care of ourselves and uh, follow your belief system. It will help the child to be calm and comfortable.
How do I offer emotional support to friends or family members or co-workers who have been quarantined?
Connect. This is the best time to connect in all possible ways. You may not go and meet them, but mm, if you are good at baking, bake a cake and send to them. Small cards, get well soon, sharing some nice jokes, and if you, it can be your classmate, it can be your colleague, but lighten up the environment. Don't be their medical doctor. I'm saddened to say, in India, outside hospital environment, every citizen is a doctor of some kind. And we give unwanted, unsolicited advice. In these kind of scenario, when you're overloading somebody with the advice, he or she is going to become more stressful. That my friend said, my auntie said, I did not do this, that's why maybe I'm sick. So there are important things. You can share a calming technique, simple as, okay, that virtually we both are going to have a small chanting session. We can have virtual relaxation exercises through a common app. That way, you will be exchanging good content and will be actually supporting the person.
How to help the patients? This is the last question. How to help patients admitted to COVID wards in coping with the fear of hospital acquired other infections, and they may be seeing all the death and disease around them and get very, very stressed out.
Yeah, this is again important, and in this long scenario of illness, hospitalization, most of the times, the thing which you've said, ki somebody is concerned about hospital acquired infection. I cannot deny that it does not happen. It does happen. But most of the time, most of the hospital and systems are well equipped to take care and monitor. Again, it comes back to the basic. If the system is generally healthy, fighting infection is not impossible for the body. It is our willpower also which matters a lot. If somebody is going to be negatively impacted by the grief scenarios, as the queries about some death or some major illness happening, major infection surfacing, one still needs to think that there have been previous infection or health issues in life of any individual, whatever age we are, whether we are a 80-year-old or 50-year-old or 11 or 20-year-old. Some fall, some accident, some illness, some infection has been in the body. It may not be COVID, but it may be something else. So generally keeping that attitude that if I have been able to come out of that situation, I'll be coming out of this also. Post discharge from the hospital, one can be more cautious about knowing the symptoms and being connected to the doctor or professional. Here I have to say, brain and body are interdependent. In other words, mental and physical health are two sides of the same coin. Learn to manage and improve mental health, the body will improve. Provide the body the adequate nourishment, healthy, nutritious food, good sleep, good, healthy environment, clean environment, the brain will flourish, the body will improve. About the grief situation, somewhere we also have to acknowledge that death is an eventuality of all organisms. And in this scenario, it has been accelerated because the circumstances are different. Many people are not able to be with their family members in their last hour. But we have to accept that it is not the end. It is a transformation of this biological form into some other form. Whichever belief, religion systems or value systems we come from, these are the core energizers which help us to relate to these eventualities also. I would also say in the families where losses of an individual due to the pandemic has happened, it is important the social circle, the friends, family, colleagues, do help them to come over the grief. We cannot bring anybody who's gone, who's crossed over the rainbow to the other part of the identity. But the person's memory is always there with us. And we have to accept that that memory is the surviving form of that individual. We cherish the individual for their virtues. We give respect in whatever form and belief system we come from, and let it be part of the entity in the change of the bigger cosmic process. I would just like to end here that using as a probable an example from the history, uh, mythological history, I would rather say, that in the epic of Mahabharata, Yudhishthir was asked the question by Yash that what is the biggest surprise of this human life? And Yudhishthir, being the wise, he answered that death is the biggest surprise for human entity, because all of us know about it, but the moment it strikes us or our near dear ones, we are overwhelmed, and we lose our cognizance of the surviving individual. So yes, the loss is there, the grief is there, we acknowledge it, we support them, but we also see it as a transformation for that individual into some other better identity.
Thank you so much, Doctor, for this very, very insightful session. And I think every one of us has been benefited because this kind of stress and anxiety is all pervading and we all have it. Viewers, if you have more queries, please reach out through our Facebook Messenger or place your comments on the Facebook page. And we will meet tomorrow at the same time. And we're going to talk about black fungus and other lung infections in COVID-19 with Dr. Rama Narasimhan from Apollo Hospitals, Chennai. So meanwhile, take care, be safe, and make sure that you follow all the insights and tips that Dr. Singh gave so that you can be stress-free, relaxed, and you can face whatever comes with a very calm and collected mind and with confidence. Don't also forget our SMS, which is the sanitizing, the social distancing, and the masking. Thank you very much and namaste.
Thank you and keep well.